Next, we are going to review wound care, showering, and bathing. The dressing that your surgeon has placed on your knee is waterproof. This will stay on for several days after surgery. Where it's waterproof, you could shower as soon as tomorrow. We do strongly recommend waiting for physical therapy to come and evaluate your home and shower before doing so. While recovering, we ask that you avoid bathing, submerging your wound in any form of water until you are cleared by your surgical team. You are going to remove this dressing on day 7 and leave the incision open to air as long as there is no drainage. If there is a small drainage amount that is either clear or pink in color, you're going to place a dressing on or a large band-aid to cover those areas that are draining and change this daily. We're going to send you home with the additional supplies that you'll need if you are in need of replacing it due to drainage. Again, drainage should not be green or yellow in color or have a foul odor. If so, please reach out to your surgeon's office. If there are staples in place, those will be removed on day 12 to 14 after surgery, and steri-strips will be applied to the area. These staples can be removed by either physical therapy, your visiting nurse, at your post-op visit, by a primary care physician, or at a rehab center. If you have striders in place, please keep them dry for 72 hours. They will begin to fall off on their own. You do not need to remove them. Okay? For activity, you are allowed to put as much weight through this operative leg that is comfortable for you. You'll be using either crutches and/or a walker until you are steady enough on your feet. Make sure to get adequate rest while icing your knee and/or hip regularly. Physical therapy will review your cold therapy ice cube with you later today. You should be up and walking as much as possible once you return home from surgery. Gradually increase your daily activity as you feel comfortable. When you feel increased pain from the activity, you may need to stop because you are overexerting yourself. It is normal to feel some muscular pain after activity because these muscles haven't been used in a long time. But when you start feeling increased pain during activity, stop and rest. Use your body as your guide. You may drive when you are no longer taking narcotic pain medications, you feel comfortable sitting in a car, and you have adequate range of motion in your neck, arms, and leg. If you have the operation on your right side, we ask that you wait 3 weeks prior to beginning driving again. We have sent a referral to a VNA service with your information. We ask that if you have not heard from them by 12 on the day after your surgery, please reach out to them. Both the phone number and the name of the VNA is included on your discharge paperwork.